suppurative lung diseases. Bronchiectasis, deaf, persistent dilatation of medium-sized bronchi accompanied by suppurative inflammation of their walls. Idiopathogenesis, awakening of the bronchial wall by a. Chronic suppurative inflammation, due to recurrent septic bronchopneumonia. b. Congenital weakness, leads to congenital bronchiectasis. 2. Bronchial obstruction, by foreign body, bronchial secretion or tumor. The surrounding alveoli are fibrotic and collapsed. NE. Dilated bronchi. Cylindrical, fusiform or saccular. Bilateral. Basal. Has patchy distribution. The bronchial lumen contains pus. The bronchial mucosa, ulcerated. The surrounding alveoli are fibrotic and collapsed. The pleura shows pleurisy. Draining hilar L nodes, enlarged. Complications, spread of infection, direct, lymphatic and blood. Hemoptysis. Lung abscess, post-bronchiectatic lung abscess. 2-ry amyloidosis. Lung fibrosis. Bronchogenic carcinoma, squamous cell carcinoma, pneumonitis. Classification. 1. Bacterial pneumonia, lobar pneumonia and bronchopneumonia. 2. Viral, interstitial, pneumonia, influenza, measles, chickenpox. 3. Loeffler's, parasitic, pneumonia, bilharziasis, ascaris and ankylostomiasis. 4. Granulomatous pneumonia, TB, sarcoidosis, leprosy, syphilis, actinomycosis. 5. Lipoid pneumonia, due to aspiration of oily nasal drops. 6. Irradiation pneumonia. Lobar pneumonia. Deaf, acute diffuse fibrinous inflammation of one or more lung lobes. Etiology. Age, middle age. Predisposing factors, low resistance. Causative organism, pneumococci. Route of infection, droplet infection, pathogenesis. Pneumococci are inhaled to reach alveoli. They cause acute inflammation with excess fluid exudate. This fluid exudate passes from one alveolus to another rapidly through the intraalveolar pores of cone to involve the whole lung lobe. The fluid exudate expel air away from the alveoli, producing a firm airless lobe, leading to consolidation, hepatization, of the affected lobe. 1. Duration. 2. Gross findings, the affected lobe is 4. Stage of resolution. 3. Stage of gray hepatization. 2. Stage of red hepatization. 1. Stage of congestion. 1. Duration. 9th, day 21. 5th, 8th day. 2nd, 4th day. 1st day. 2. Gross findings, the affected lobe is. Since there is no necrosis, healing by resolution occurs. Enlarged. Gray. Consistency, consolidated, hepatized. Cut section, dry. Pleurisy. Enlarged hilar LNs. Enlarged. Red. Size, enlarged. Color, red. Consistency, like wet sponge. Cut section, exudes frothy fluid. The covering pleura, normal. The hilar LNs, normal. 3. Stage of gray hepatization. 2. Stage of red hepatization. 4. Stage of resolution. 3. Stage of gray hepatization. 2. Stage of red hepatization. 1. Stage of congestion. 3. MP. A. Alveolar capillaries. Less congested. B. Alveolar walls, thin. C. Alveolar spaces. Show dead bacteria, shrinked fibrin, hemolyzed RBCs, excess polymorphs and macrophages. Congested. B. Alveolar walls, thickened. Show bacteria, fibrin, RBCs and polymorphs. Show bacteria and fluid exudate. 3. Stage of gray hepatization. 2. Stage of red hepatization. 4. Stage of resolution. 3. Stage of gray hepatization. 2. Stage of red hepatization. 1. Stage of congestion. 4. Clinical course. Fever, cough, dyspnea and chest pain. At about 9th day the disease ends by crisis, sudden improvement, however death may occur due to severe toxemia. 3. Stage of gray hepatization. 2. Stage of red hepatization. 4. Stage of resolution. 3. Stage of gray hepatization. 2. Stage of red hepatization. 1. Stage of congestion. 5. Complications. Spread of infection, direct, lymphatic and blood, toxemia, septicemia. Lung fibrosis due to failure of resolution. Post-pneumonic lung abscess. Bronchopneumonia. Death, acute suppurative inflammation of bronchioles and adjacent alveoli characterized by patchy lung consolidation. Etiology. Age, extremes of age, young and elderly. Predisposing factors, low resistance and bronchitis. Causative bacteria, Staphylococci, Streptococci and H. influenza. Route of infection, endogenous invaders and exogenous invaders, droplet infection. INE. Bilateral. Basal. Multiple consolidated yellowish patches exuding pus and pressure. Several patches may coalesce to produce confluent bronchopneumonia. Enlarged hilar L nodes. NP, the bronchioles show. Their lumen shows necrotic epithelial cells, polymorphs and pus cells. Their lining, ulceration. Their walls, congested capillaries, neutrophils and pus cells and exudate. 2. The adjacent alveoli show 3 successive zones, zone of alveolitis then zone of alveolar collapse and a zone of alveolar dilatation, compensatory emphysema.